Hello, my name is Colin Banas. I'm an internal medicine physician and the Vice President of Clinical Product Solutions for Dr. First. We're here to talk about telehealth, a powerful tool in the fight against the coronavirus. So this graphic, I think we're all familiar with it by now. It's all about saving lives and making resources last. So clearly, we as a nation want to buy ourselves time to flatten this curve and not overwhelm our health systems. And that's through social distancing and quarantines, and even more recently, entire stay-at-home mandates. But let's not forget about that dotted line representing healthcare capacity. We really need to find innovative ways to raise that line, to raise capacity, and at the very minimum, not let that line dip lower. And I think that's where innovation and technology come in, specifically telehealth, and that's what we're here to talk about. The barriers to telehealth, geography, billing, even HIPAA penalties are being removed, even if only temporarily. And it feels like this mode of healthcare has accelerated 10 years in just 10 days. So how can telehealth help? Well, I'm sure we're all familiar with the biggest current use cases, the worried well, the potentially infected, getting them to be screened and the next best steps. And even the non-urgent, such as routine follow-up visits like weight and blood pressure checks. And depending on the specialty, there are estimates that upwards of 90% of visits may not need to be in person, especially with the advent of remote monitoring and remote examination equipment. But let's also think outside the box for other use cases too. Telehealth for EMS providers who are at the scene wanting to communicate back to the receiving hospital or to an ET3 provider program. Virtual rounding for senior physicians who may be self-quarantining or asked to cover multiple teams in their hospital. Telehealth coverage for nursing homes, home health agencies, pharmacies, all in the name of enabling the hospital without walls during this crisis. As we have seen an increase of novel care locations, care is occurring in pop-up tents, convention centers, even converted hotels. So my list of things to look for in telehealth. HIPAA still matters. Patient data security still matters. As I mentioned earlier, the relaxed HIPAA guidelines are temporary. Even the AMA continues to endorse the use of compliant solutions. Now is not the time to be using a solution that is making headlines for all the wrong reasons. Choose a telehealth solution that you can use in the future when the dust settles from COVID-19. And trust your telehealth and healthcare data to a HIPAA-compliant company where nothing is saved in the cloud or on devices, aside that evidence of the visit has occurred via timestamp. I also like to think that providers would like a distinction between personal communication modalities and professional ones. I certainly don't want to give out my Apple ID or my personal Skype address to all my patients unnecessarily. The next one, rapid implementation. This is not a time for multi-week or multi-month implementations. I'm looking for a lightweight application with low friction for both the provider and the patient. The rapid ability to upload massive amounts of users and patients with batch uploads or ADT feed integrations, and then even an option for later integration into my core EMR. I'm looking for clinician-driven telehealth. So I want to see my patients, not have them go into a queue to see a doctor in a box. I want it to be quick and easy for my patients. No app for the patient to download, no lengthy patient enrollment or registration process. I want the patient to be able to accept a text or an email invite and be taken into a secure telehealth visit. I'd be looking for unlimited usage and competitive pricing. No per session fee. Give me all you can eat, if you will. And I want to be able to use it for my entire patient population and even outside of my patient population if the need arises. A management console, quickly add users and patients, record appropriate audit logs to support my electronic records and my billing needs. And then, as I keep alluding to, beyond video visits, I think we need a platform. There is more than just video chat to telehealth, as you will see. I'm looking for an improved communication around the entire care continuum, sharing updates with the care team, family members, and even other providers. So enter Backline. Leveraging telehealth has become crucial in rapid order, And in fact, pretty soon, I don't think it'll be called telehealth anymore. I think it'll just be known as healthcare. And what Backline is a multimodal and device agnostic platform for care coordination and patient care that enables us to perform care without boundaries. So right here, we have a quick demo of the solution in action. I'll go ahead and check on my patient, Linda, see how she's doing. It sounded earlier when we were secure texting that she wasn't feeling too well. I want to check on her. So here we are. We were doing a check on Backline before. I'm going to go ahead and initiate a video chat to see how she's doing. Don't even need an app. We can do phone to phone, phone to web. I think Linda will do phone to phone, and she'll get a message that says that I'm getting ready to initiate a video chat. I'll click up here in the right-hand corner and initiate a secure video chat with Linda.
Good morning, Dr. Bannis.
Good morning, Linda. How are you feeling?
Not really well, Dr. Bannis. I have a dry hacking cough, a slight fever, and chills.
Oh my. Well, you know, we were texting earlier. You were slated to come in today for a blood pressure check. I know we've rearranged some of your medications, but that's concerning enough. Why don't we keep you at home and see if I can mobilize some of the home health team to come out and do a home check on you, maybe and do some appropriate testing. Does that sound?
That would be great.
I agree. So you stay put. I'm going to go ahead and coordinate with my team, and we'll be in touch soon. I hope you feel better. Okay, Linda?
Thank you so much, Dr. Bannis.
Thank you. We'll talk. Bye-bye. And it's that easy. So here's the platform. On the left, you can see the real power of it. We are not just video visits. There is secure messaging, automated alerts, such as to a PCP when a patient gets admitted or arrives in the emergency department, full document and photo sharing, and things like electronic forms and e-signature. And this is all from a company that's been powering healthcare for over 20 years. In the middle, once again, you can see that the platform is device agnostic. There is low friction for both patients and providers. And on the right is the depiction of care without walls. We don't just have the ability to touch your patients or only providers in your particular network or practice. Backline can reach out to anyone, even fellow clinicians who aren't Backline subscribers or provisioned in the app. It really is simple, powerful, and fast. So with that, we'll close. If you want to learn more about how Backline can help those on the front line, please reach out today. Thank you so much.